Good afternoon and welcome to today's webinar, COVID-19 in Indian Country, Past Policy, Current Responses, and Future Implications, brought to you by the Network for Public Health Law and the American Society of Law, Medicine, and Ethics. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your questions. We'll be addressing them during the Q&A session towards the end of today's event. Your moderator for today's webinar is April Shaw. Dr. April Shaw is a staff attorney at the Network's Northern Region office. She is interested in a variety of health equity issues as they relate to economic, gender, and racial disparities. She is particularly interested in thinking through how multiple inequities intersect to create systemic disparities. April was previously a research scholar at the Center for Public Health Law and Policy at ASU's Sandra Day O'Connor College of Law. She worked at the Project on Predatory Student Lending at the Legal Services Center of Harvard Law School and, prior to that, as a senior law clerk at the Arizona Court of Appeals. April will be leading us through the rest of today's webinar, so April, over to you.
Thank you, Charles. I'll go ahead and introduce the speakers for today. Heather Tanana is a citizen of the Navajo Nation and an assistant professor at the S.J. Quinney College of Law, University of Utah. Heather is experienced in state, federal, and tribal courts and clerked at the U.S. District Court for the District of Utah. Heather is also associate faculty at the Johns Hopkins Center for American Indian Health, where she teaches and collaborates on health policy-related work. Her research interests include exploring the overlay between environmental and health policy, promoting better practices in Indian child welfare, and criminal justice in Indian country. Ayla Haas is a public health attorney and assistant professor of law with the Native American Law Center at the University of Tulsa College of Law. She previously served as a visiting assistant professor at Indiana University Robert H. McKinney School of Law. Her research explores topics at the intersection of Indian law and health law. Ayla previously served as a staff attorney for the Centers for Disease Control and Prevention's Public Health Law Program, where she worked to improve public health through the development of legal tools and the provision of legal technical assistance to state, tribal, local, and territorial governments. Ethel Branch is the founder of Navajo and Hopi Families COVID-19 Relief Fund and is a member of the Kanji and Katsen PLLC, currently on leave of absence to focus on relief effort work. She is a former Attorney General of the Navajo Nation and is a graduate of Harvard Law School, Harvard Kennedy School, and Harvard College. Philomena Quebec belongs to the Bad River Band of Lake Superior, Chippewa, and is a 2008 graduate of the University of Minnesota Law School. She currently serves as a policy analyst for the Great Lakes Indian Fish and Wildlife Commission and the co-coordinator of the Guayaco-Bimadazawan Bad River Needle Exchange. The Guayaco-Bimadazawan is a community-led tribal harm reduction program providing sterile injection equipment, overdose prevention, nutrition, and social support to community members who use drugs from the Bad River Reservation and beyond. The program seeks to empower Anishinaabe who use drugs to improve the public health of the overall community. And with that, I'll turn it over to Heather.
Hey, I am so excited to start us off today, and my presentation is really going to set the background and backdrop for what follows. When we look at a public health issue, it's really important that we understand the different factors that can influence it so that we can try and address it. And when we're looking specifically at Indian country and tribal communities, the historical and legal considerations are one of the two most important. I know we have a wide range of participants here today. Some of you are very well versed in Indian law, some of you have worked in your tribal community, but I anticipate that some of you have not. And so that's what I'm going to provide some basic background. I'm going to go quickly because you could talk about this for hours. There are entire courses about this, but I'm hoping my slides identify kind of keywords, information for those where this might be a newer area that you can follow up and do research for. So going on, American Indian history is U.S. history. And I'm really shocked by how little the average American knows about tribes and the tribal relationship with the federal government and states. And if we look at the federal Indian policies, the eras really provide a good timeline of what was happening in this country with tribes and with the federal government. I'm going to talk a little bit more about the doctrine of discovery, but initially, right, 1492, when Columbus came, no big surprise, the Americas were not uninhabited. There were people already here. And that's an important concept to remember because tribes predate creation of the United States. And when the United States came into being, they entered into treaties. So you see the treaty-making area, right? These names are kind of self-explanatory. And again, given time, I'm not going to dive too much into them, but at some point, the federal government decided, well, we need to push the Indians westward. We need to make room for the settlers. So we have our Indian removal area. And then, well, surprise, the West, there's actually valuable resources out there that we might want. So we're going to limit Indian people onto reservations. And then we get into our allotment area where an assimilation where we want to make Indian communities like white communities. And we can do that by making them farmers. So we're going to divide up the land, allot it to Indians. And the takeaway from that era is that it allowed what was previously kind of tribal lands, reservation lands, to enter into non-Indian ownership. And that's where we hear this concept of checkerboards, right? Indian tribal land, non-Indian owned fee land, very important for kind of later discussions when we're talking about policy. And then the Indian reorganization era was interesting because it was an era where the federal government wanted to encourage tribal development, but it wanted tribes to do that in a white American way through what the federal government and states were doing with their form of government and their form of judicial systems. Then we switch back, termination era, relocation, where over 100 tribes lost their status and were terminated. And even though many of those tribes, most of them were actually restored, still very traumatizing to lose your identity and to lose their land. And then our last era here is where we are today, our Indian self-determination policy era that emphasizes tribal sovereignty and, most importantly, tribal control to do and implement their policy, their laws in a way that is culturally appropriate for that tribe. So again, very brief summary, but there's a lot written about these that you can learn about more. And this is important because you'll hear discussions when we're talking about COVID-19 and the impact in Indian country. A lot of people will say, well, the dire conditions are a result of these past policies putting Indian communities into the circumstances that they find themselves. And going to my next slide, I think this slide is really the most important. It's easy to read about past events, to read up about the laws, but the impact that they've had on Native people in our country is a little bit harder to understand if you yourself do not have a connection to that history through your family or by living in a tribal community. And the takeaway that I want you to have from this slide is that the policies that I very quickly ran through, they created misguided beliefs and actions toward tribal communities that resulted in historical trauma that's still felt today. These were problems that were identified by the white leadership and federal government, and they were solved in a white way. So, for example, the boarding school era, that's something a lot of people are really familiar with, right? Native children were kidnapped from their homes. Parents didn't know if they would see their children again. And in theory, that problem that the government was trying to address, the education of Indian children, that seems like a worthy goal to attain. You know, let's educate the children, let's get them ready for success. And my own father, excuse me, I get a little emotional. My own father was taken away from his family to attend a boarding school. And he didn't know when he'd see his mother again. And the outcome of that, many of us would say, was a great outcome. He became a physician. He dedicated his entire career to uplifting the health of Indian people, right? That is a very American success story on the surface. But I encourage us to think a little bit more. Most people don't know that my father, when he was taken away, was very scared, that he was frightened and confused, that he and other children were whipped for not speaking English or trying to speak their language, trying to hold on to their culture. And one night, he and another boy ran away in the middle of the night on a very cold winter night. And at one point during that journey, my father thought he would die. It was so cold, he couldn't move anymore. And it was only because a rancher came by and happened to find my father and his friend that he lived. And he was returned to the school. And so, yes, the initial goal was worthy. And maybe the outcome in the end was good as well. But how we got there, I encourage us when we're dealing with communities that might not be our own, don't impose our solution on them. Because I think there was a much better way to have educated the Indian children in this country than stealing them from their families and making them go through what my father did. So, again, a lot of the history, the law you can read about, but these stories to me are the most important, and they're going to really underlay all of these other presentations as we go forward, as we address challenges in Indian country and how to survive, how to resolve them. Again, all of these on the column here: forced sterilization of Native women against their knowledge, without their consent. All of these things have happened to tribal communities, and the scars remain today. So back to more the how do we address these issues? We are going to be dealing with a backdrop of, well, what are the laws in this country? And the U.S. Constitution identifies the federal government as the main party, right, that's going to deal with Indian tribes. And that's our Indian Commerce Act. That's where the authority comes from the federal government. And again, a lot of people, I think, who aren't familiar with this area may be a little surprised that the Bill of Rights doesn't apply to tribes. That's why we had our Indian Civil Rights Act. You can, encourage those, or this is new area. It's kind of fun to read up about it. Back in how we deal with tribal nations on a government-to-government relationship, right? That tied back to what you'll hear as the Doctrine of Discovery and the Marshall Trilogy. And the Marshall Trilogy is a series of 3 cases. Well, Chief Justice John Marshall was the chief of the U.S. Supreme Court at the time. And the very first case of that series, Johnson v. McIntosh, laid out this legal principle that tribes and Indian people, they were discovered. They weren't conquered. And because of that, they retained some degree of sovereignty, right? And the other 2 cases go on to further kind of develop this principle. In the second case, Cherokee Nation versus Georgia, you'll hear about this term that tribal nations are domestic dependent nations. They're still reliant upon the federal government. And then I like the third, Worcester v. Georgia, because in that case, the Cherokee Nation, right, Georgia was trying to impose on the Cherokee Nation, and there was very strong language from the court that the state of Georgia could have no force whatsoever on the Cherokee Nation. And so I like to read that case because it emphasizes at the beginning, many years ago, how strong tribal sovereignty was viewed, and it helps us recognize that while it's still here today, there have been threats against it, and it's evolved a little bit. But big takeaway, tribal sovereignty still used regularly. Tribes are still present today, and because of that, there's two ways to look at that, I think. One is tribes have the right to enforce their treaties and the promises that were made to them against the federal government, right? McGirt, the recent ruling by the present U.S. Supreme Court, really emphasized that. And then the other half is that as sovereign nations, tribes also have the power and authority to enact their own laws. And that's really what ILA will be talking a lot about next. So they have the right to govern their people and their lands. Now, in the remaining time that I have, I want to quickly run over civil jurisdiction. Because our public health laws are going to be civil in nature, and who has authority where and over whom, right? These are questions that we need to figure out. And the landscape has really changed over time. So I'm from this, here in the state of Utah, and you can see kind of the tribal lands there originally, and then our broader United States. And then today, the tribal lands have, big difference, right? The orange highlights on the Utah map are where the tribal lands are today. You can see we have a portion of the Navajo Nation there along the southeast corner. And then the broader U.S. map, right, the purple identifies the different lands there. Kind of a little older map, but right, because we'll have a little bit more maybe in Oklahoma now after the McGirt decision. But the lands have changed, our landscape has changed, but tribes are here. They have, right, the pictures here of the Navajo Tribal Court, and you can see the council there gathered in that lower picture as well. So what can they do? Okay. Tribes are going to have, as a part of their inherent sovereign powers, the ability to promote and protect health of their citizens and their community, right? This is very well recognized. Tribes are at their strongest when they are governing their members on their lands. But then when we look at states, okay, we've come a long way from the Marshall Trilogy, where states absolutely could not do anything in Indian country. And now it's more a question of, well, are states infringing on tribal sovereignty? Certainly we have our preemption. States can't do something if it's preempted by federal law, right? We know the feds have that, are acting under the Indian Commerce Clause to regulate tribal nations. But we're starting to see some states kind of encroach a little bit on sovereignty more recently. But again, if we're talking tribal members on tribal land, then our default is going to be, well, no, states can't go there. What about the flip? What about tribes trying to regulate non-Indians within their reservation? And especially if we're dealing with one of our checkerboard situations where non-Indian might be on non-Indian owned fee land, right? We're getting into more murky, tricky territory here that's going to be very fact dependent. So in general now, we've defaulted to, well, tribes generally are not going to be able to regulate non-Indians, but the Montana case set forth the circumstances when they can. When is there a consensual relationship? Is there a contract at place, right? That was our Dollar General Corporation case that made it up to the Supreme Court, but it ended up being a tie, 4-4, but the lower decision did affirm that a contract had been in place, and in that case, the Mississippi Choctaw Nation was able to regulate a non-member, non-Indian behavior. So that provision is still there, but really I think what we're talking about here with public health law is going to be the second exception, that tribes can exercise jurisdiction over non-Indians when their conduct threatens or has some direct effect on the political integrity, economic security, or the health and welfare of a tribe. We have a non-member that knows that they are infectious and they're leaving their home, going out into a tribal community, not wearing a mask, exposing others. Does that threaten the health or welfare of the tribe? I'd say yes, but I will turn this over to Isla, who will go into more specifics on the tribal responses. Thank you. Yeah.
Good afternoon, everyone, and many thanks for being here. Heather, thanks so much for giving that great intro to tribal sovereignty and history, and for your willingness to share some of the own stories from your family. My name is Isla Haas. I am joining you from Tulsa, Oklahoma, where we are getting a little bit of a reprieve from the 90-plus weather we've been having, and it's been in the 80s today, which I'm very, very grateful for. I know webinars and Zoom calls have been a little challenging for folks since we are doing our best to stay at home safely. So I want you all to picture me at my desk at the office where the internet is better. And I don't know what your space looks like, but mine includes 2 cups of water, 1 fizzy, 1 plain, 2 cups of tea, 1 cold for this morning that I didn't finish, and another one that's lukewarm. And so wherever y'all are joining from, I hope you are staying safe and engaged in your important work that you're doing. So I wanted to do a quick disclaimer. I am so grateful that I am an attorney that gets to work on public health issues, and I hope I could find ways to support all of you in your work. But what I will be sharing you today is just for educational purposes and not legal advice. I want to start off with a definition of public health legal preparedness from some of our colleagues at CDC. This idea of in crises, whether it's disaster, infectious disease, what role does law have in the work that we're doing in terms of both the response, in terms of prevention, and in terms of after action activities. And so I wanted particularly, in addition to knowing and understanding that law can be used as a tool to support public health, and knowing and understanding that law needs to be a consideration when you are implementing and planning your day-to-day procedures and plans, I also want to acknowledge this idea of the recognizing perceived and actual legal barriers to implementing certain public health response and prevention activities. And I'll be highlighting, I wish we had more time together, I'll just be giving a little bit of a snapshot of some of the federal legal barriers, but also some of the barriers that come into play when we're talking about state and tribal jurisdiction, and just some of the considerations, I won't call them barriers, that tribes are having to consider in terms of their implementing their own public health practices in response to COVID. I also leaning on what Heather has already shared, when we're thinking about legal barriers, it is really important to understand that there are different layers. And so often, folks will, in perpetuating legal barriers, whether it is a legislature, a governor, someone sitting at a desk at CDC trying to implement funding programs, will say, well, I can't do that. That's against the law. And there's very much a difference between what's against the law and what's been existing practices or just myths about the law that aren't necessarily true. And I would argue that in a lot of cases, interpretations of laws, particularly federal laws, as they relate to tribes and and especially in public health situations, those interpretations are often going to be rooted in racism and modern day colonization. And so I encourage all of you all that are a partner to tribes, whether situated at the federal level or the state level or the local level, to really take a good look at what you could be doing differently in your work to avoid perpetuating these kinds of barriers. Now, what are some of the barriers we're seeing at the federal level? Well, we have, unfortunately, throughout the entire history of tribal-federal relations, the reneging on treaty and trust responsibility requirements for healthcare. This has been true since the beginning of this relationship, and modern-day manifestations of that is the fact that despite the federal government being constitutionally required to provide healthcare to tribes and American Indian Alaska Native communities, they have chronically failed to do this by chronically underfunding the Indian Health Service, by creating limitations in funding. So when we think about the very successful program, Special Diabetes Program for Indians, which started in 1997, funded over 400 tribal diabetes prevention programs, and yet, despite all of its success, it has been relying on precarious funding over and over again with temporary reauthorizations and funding, the current expiring towards the end of the year. And this matters not just in the fact that it violates the treaty and trust responsibility, but because when we're looking at COVID-19, we know individuals with diabetes are more likely to have worse health outcomes in terms of their infection and morbidity and mortality. And that is just so unfortunate already when we know that the health inequalities facing many American Indians and Alaska Natives include diabetes. And when we've got a successful federal program that exists, why should that not be permanently reauthorized? Because this treaty obligation to provide health care is permanent. We've also seen the federal government reneging on statutory responsibilities in terms of public health data access. I would argue under the current language of the Indian Healthcare Improvement Act that the Department of Health and Human Services and the Centers for Disease Control and Prevention is required to promote access to public health data to tribes and tribal epicenters, and yet we're seeing repeated examples of difficulties in obtaining data related to COVID-19, not to mention all sorts of other public health issues. And that's against the law as far as I'm concerned, and it is hampering effective response at the tribal level. I want to also highlight, again, I don't have time to talk about every single issue, but very simple, effective measures that could be done now to make a huge difference. The Strategic National Stockpile, the current language of the Public Health Service Act, does not guarantee tribal direct access to the medical supplies in the stockpile. And despite multiple bills being introduced, both the House and Senate, to amend that, that's just not the case. And so how is it that the federal government has a trust responsibility, has treaty responsibilities to provide health care, and yet they are only obligated to provide medical supplies to the SNS, to states and local governments under the law? It doesn't make sense, it's wrong, and it's racism. Another way that we could see better implementation of federal laws and requirements is consultation. So because of executive order, a series of executive orders, every federal agency engaging in any kind of action, including policy decisions that are going to impact tribes or American Indians or Alaska Natives, are required to consult with tribes before they implement that action. And yet we see over and over and over again consultation activities to be an afterthought, non-existent, or merely let tribes know what they've done, what the agency has done, and not how the agency can be more effective. And again, it's wrong, and frankly, as far as I'm concerned, against the law. So we have seen, and this is true in terms of any kind of public health response with any government, intergovernmental coordination issues, and this is where There can be concerns in terms of data access. So a state may have more comprehensive data or just enough data related to tribal communities that would be useful for tribes or tribal owners to have access to, and yet we're seeing barriers in terms of accessing that data. There are ways to mitigate that is through data sharing agreements or to just share resources and support from tribes supporting states and local governments and states supporting tribes as needed, depending on what resources are available at each government. And cross-jurisdictional agreements and memoranda of understandings are a useful tool to support that kind of intergovernmental coordination. But some of those challenges that come into play are really important at the tribal level, in that oftentimes partners, state and local governments, would prefer or will require that there's some sort of waiver of sovereign immunity. So in turn, waiving protection from certain tort liability at the tribal level. And that could be incredibly dangerous for tribes to do, and it creates a lot of exposure. And so while these are an important tool that I fully support, they really can't be entered into without substantial considerations with the tribe and tribal attorneys. The other piece that Heather set up so beautifully when we're talking about civil jurisdiction and public health practices, when we have a highly infectious respiratory illness like COVID-19, we have challenges in terms of really piecemeal implementation of effective public health responses. And we have seen this play out in every part of what's now the United States, right? We've got state governments trying to preempt local governments for establishing certain stay-at-home orders or mask requirements. We'll see certain cities within a county implement requirements, but then other cities not, and other parts of the county they're not being applicable to. And so this comes into play absolutely at the tribal level as well. So tribes choosing to implement measures like mask requirements, stay-at-home orders, curfews, and then their neighboring jurisdictions are not going necessarily to do the same. And so, as Heather already beautifully outlined, I would argue under current federal law that tribes can have jurisdiction to implement some of these public health measures on non-tribal members, even though the default rules that they do not usually. Now, could that be challenged in federal courts that are often not working and deciding cases in favor of tribes? For sure, but I don't know in our modern public health practice that we have a more pressing, urgent, immediate public health crisis like COVID-19. And we already know, unfortunately, that tribes and American Indian and Alaska Native communities, some of them have been disproportionately burdened by this. There's a couple of other things to think about at the tribal level. As we all know, many tribes already have really robust, beautiful tribal codes that contemplate so many public health responses, but still COVID-19 for so many communities, whether at tribal level, state level, local level, federal level, has posed new challenges. And so tribes have the authority to implement those laws, especially to mitigate the gaps that we're seeing at the federal level and at the state and local level. And one of the things that I can't speak to personally as I don't represent a tribe, I'm not a tribal member, but how so many tribes have been incorporating their culture and traditions in terms of implementing quarantine, isolation, different requirements in a way that is best for their communities, and that's a really beautiful thing to see. And I don't think the same kind of cultural considerations, and especially considerations for vulnerable populations, is always as incorporated at other levels of government. One of the areas that I wish I could teach a whole class on is intragovernmental responsibilities at the tribal level. So we are finding, because of the nature of some tribal governments, often public health services or health services are decentralized and spread out over a bunch of different departments. So you might have an environmental management department or agency that engages in some public health activities. You might have a health and human services agency that does some public health, and you might have a tribal clinic that might be engaging in activities. And all of a sudden, we're seeing a need for more contract tracing, a need for more data collection and analysis, and a need for more coordination between other governments. And so how does someone designate who's going to be doing contact tracing? Does that need to be outlined in the tribal code? Does there need to be some sort of resolution coming out of one of the tribal council committees? And so that's really the challenges of what is that relationship between a tribal clinic which might be run by a non-member, non-Indian MD, conducting activities that are generally core governmental activities, and what kind of approval and processes that are coming to play. And of course, always when we're talking about public health, we might have privacy and other case disclosure issues, which we don't have a ton of time to talk about, but I'm happy to share some resources for those that might be interested. So I don't have time to talk about all these slides, but I did put some information here so when the webinar recording and slides are available, that you have a few bullets on some of the things that I had just spoken on. And I think it's important to loop back to what Heather has said in terms of historical trauma. It is so easy for public health practitioners that are so talented and so committed to the communities and to promoting public health to think that their actions are not going necessarily to be harmful to tribes or tribal sovereignty just because they mean well. And unfortunately, a long history of laws and government interactions at the federal, state, and local government tells us otherwise. And so I really encourage folks to consider, no matter where they are situated, to think about what they might be doing differently in their laws, their agency policies, their programmings to better support and honor tribal sovereignty, and at the minimum to not be undermining it. And so what does that look like? Do you have a policy that is going to impact Native communities? Then you can engage in consultation, even if it's not required by a state executive order or state legislative statute. You can ensure, if you're providing funding to, let's say, local governments, that you are providing direct opportunities for tribes, not necessarily to have to compete with state or local governments. When you are developing programming and you are not considering your Native population, whether it is a small population or a large population, that is creating harms to tribal communities. And we are seeing every day those harms have adverse health outcomes. And so again, not engaging with tribes when you're doing, even if you are implementing work to support Native communities, but not engaging with tribes and tribal serving organizations themselves can be really harmful, because the effort that you can be putting, the policies you're implementing, and the money that you are putting in might not be going to the best place. And so that's really an important consideration. So with that, I'm just going to leave my contact information up, and please don't hesitate to reach out if I could be of any support or to direct you to some of my incredible colleagues working in Indian country on this issue. Thank you. And with that, I'm delighted to pass it over to Ethel.
So much, Isla. Yes, as a Ethel Branchinsha, being Potwani Nishla, Nakai Bashishin, Sinajani Dashache, Do Nakai Dashanala, Kenyan Diablo de Nasha. Thanks so much. I'm really honored to be a part of this panel and excited at the level of interest by all of you. So thanks for joining. I think I'll start just by mentioning just some background. I was the general counsel for Havasupai tribe, and just wanted to mention that, they took a very unique approach to addressing COVID-19 in their community. They basically went into total lockdown. I had been tracking COVID-19. I listened to a podcast about what had happened in Wudon back in January. And so it was just shocked at, an entire city shutting down and allowing people to leave only to do grocery shopping. And then, watch the spread of COVID to the United States and Seattle. And I have a friend who works in an ER unit there, and was just seeing, how that system was being overwhelmed. And so I was very concerned, knowing just the percentage of tribal members who are high risk of adverse results if they catch COVID-19. And so, as I was advising Havasupai, I advised them to take a pretty aggressive response because, they have a community of 700 tribal members, many with, these health conditions. So we were concerned, and they're geographically relatively isolated. They're located in the bottom of the Grand Canyon, and the only way in is by helicopter or by hiking down an 8-mile trail. And so it was relatively easy for them to isolate. And they started out gradual. First they closed the community to tourism, which was a tough decision because that's where they get most of their funding. And we were entering into tourism season. And so that was the first measure. And then quickly after that, they took additional measures to shut down their border. The first measure was to stop all travel by anyone living in the community except for essential purposes like getting dialysis in the neighboring community. And then went even further by further restricting the list of essential purposes for travel and put in place a pretty strict checkpoint. So anybody coming in would have to get their temperature taken, and be questioned about where they went, and then would go into a mandatory 2-week quarantine. And that was very effective. They still have not had a single case in their community, and meanwhile they were located right next to the Wallapai Reservation, where they've had, as of yesterday, 130 cases and 13 deaths. So you can imagine, for a community of only 700 members, 130 cases and 13 deaths would be quite devastating. And so that's one approach that I've seen. That was very similar to the approach that New Zealand took. They also acted very early. Havasupai put these measures in place starting on March 14th. And New Zealand was one of the earliest countries to enforce restrictions, which included a 2-week quarantine required for anyone wanting to enter the country. They closed their borders off to all non-residents, and they modeled their approach off of China's approach to the virus. And then I've seen, other approaches, like at Hopi Reservation, it was more of a village by village determination. The village of Bakavi shut down very quickly. They became aware of a case in the community, and it's been very challenging. The hospitals are not always sharing information with the governments. So, one of the government administrators learned about it through word of mouth. And unfortunately at Hopi, that's how they've had to learn about these cases. And so the community administrator shut down the village, put in place security at all the entry points, and has only been allowing tribal, residents of the community in and out. And then one by one, the villages began adopting similar measures, which is very needed because, they're located in the center of Navajo Nation. And so they're essentially in a hot zone. And then, of course, there's Navajo Nation, and I'll go into that a little more in detail, but just to give you a broader perspective, in terms of the high case rates, the highest in the country right now is apparently the Mississippi Band of Choctaw Indians. And then second highest is White Mountain Apache Tribe, also in Arizona. And then third is Navajo Nation. And their current rate is 4,811 cases per 100,000 people. We have 170,000 tribal members who live on our nation, and that's about half of our membership, our enrolled membership. And then the next few tribes, the Pueblos have been very hard hit. The next few tribes that have the highest rates are Zia Pueblo, San Felipe Pueblo, and Key Pueblo, and those are all out of New Mexico. When you look at this data and you compare tribes statistics to national statistics, state statistics, there are 7 tribes that have higher case rates than the first state, and the first state being New York, with a case rate of 2,072 cases per 100,000. So that's, less than half of the rate at Navajo Nation. And in terms of where we are right now at Navajo, we have a tally of about 9,469 positive cases so far as of yesterday. Almost 500 relatives have passed away. We're at 480 with that number. But that's actually kind of a positive thing. It's less than 10%. When I look in other situations, like with Hualapai, they had 130 cases and they've had 13 deaths. So that's 10%. So Navajo's been successful at keeping the death rate down to about 5%. And then, not to fail to mention the positive side of things, they've had almost 75,000 negative cases. And the perspective on the tribal government at this point appears to be that the curve has flattened and things are getting better. The nation is slowly reopening and sending tribal employees back to work with, certain restrictive measures in place. And so when things started to get really tricky in Arizona and New Mexico in March, the nation started taking measures. We didn't have our first case until March 17th, but the Navajo Nation began acting the week prior, similar to Havasupai. So the first measure they took was to close the highways to tourists, just to close tourism down. They didn't really take any enforcement measures with respect to that I'm aware of. Like, they didn't put in checkpoints like they did at Cheyenne River Sioux. But they did close the parks and were asking tourists to not travel through the nation. And then put in place evening curfews. They began shutting down their government, sending home everyone except essential employees, and then began imposing a weekend curfew. I believe the weekend curfew started the end of March, and then they began making mask wearing mandatory. Again, now they're reopening. There was an August 16th order where they are limiting they still have the evening curfews in place, but the weekend curfew is now pretty much limited to Sunday. They're still requiring masks, and now they're allowing drive-through events as long as there's no contact. And I mentioned Cheyenne River Sioux, so I'll just tell you a little bit more about that. I don't know where that is exactly at this moment, but they used a really novel approach where they were stopping everyone who was entering their territory and asked them, where are you traveling from? Where are you traveling to? How's your health? Have you experienced any symptoms? And then they would check the COVID rates for the communities where people were traveling from, and were turning people away if they were coming from those areas, and they view that as very successful. Early on, I don't know what the statistics are now, but they ended up when they first implemented this in about June, they had only experienced 6 cases in their community. So, and they attributed this checkpoint system with that success. And so I'll just give a brief nod to that comment about civil liberties. In South Korea, they probably have had the most extensive response of a country, and they were very aggressive. They scaled up production of tests very early, made those highly accessible, did a huge public education effort. They used contact tracing, and they actually required infected people to download the tracing app and find them if they left isolation. And so, that's crossing a civil liberty line for sure, but was very effective at combating COVID-19. And they also use the apps to just alert people of high-risk areas. And Taiwan did something very similar in terms of closing off borders and required the SIM tracking for folks who had COVID. But now to get to the slideshow that I have. I'm going to tell you a little bit about really a non-governmental approach to COVID-19 in our community. On about March 15th, I did my own personal shopping to go into isolation. Things were getting difficult in Arizona. There's a huge spike in cases. So I did that for myself and my mother and my nieces. But my mom lives on the Navajo Nation without running water or electricity with my nieces. And so I was trying to find things that they needed, non-perishable items, and it was really difficult. There were lots of barren shelves. And so I became very concerned because, I know that so many of our elders live in remote areas and they also don't have running water or electricity, and they really need these non-perishable items, and they travel for hours just to get to the grocery store. Our nation's the size of West Virginia, and we only have 13 grocery stores. The quality of food is just not as fresh as it is off reservation. So people often travel off reservation to get all the things that they need at the grocery store, as well as, combining that with purchasing other items that they need and doing their laundry, things like that. So I was really concerned about, number one, whether people were taking this seriously, especially, in the remote corners of Navajo Nation, whether the information was reaching them, and then concerned that if once they came to town, they might not be able to find all the things that they needed, and they might have to go hunting for those items and thus further expose themselves. So I wanted to do something to help with this. And so I did an exploratory post on Facebook saying, hey, does anyone want to help, contribute to a fund where we'll go buy stuff for folks, elders and immunocompromised who live on the reservation, and provide them with those items so they don't have to come here and expose themselves. And at that time, it was showing, cases in Arizona, New Mexico, and Utah, but there was no data of any cases on Navajo Nation. And of course, the first case wasn't until the 17th. And so that was a popular post, so I went ahead and formed a GoFundMe and formed this initiative, the Navajo and Hopi Families COVID Relief Fund. And I'll go ahead and just flip you through the slides really quickly. We've eventually formed a nonprofit on April 1 under state law in Utah because it just kind of became this big thing. We started, we were raising hundreds of thousands of dollars very quickly. There was a lot of positive support, mostly women. I reached out to a bunch of really great women I knew who care deeply about our community and were located all over the nation because I want to make sure we could spread the relief as far and wide as we could. And so those ladies stepped up. Literally the next day after forming the GoFundMe, one of them just went shopping. And then that started, the rest of us were like, oh my God, we need to get out there and start shopping too, because stuff was just flying off the shelves. And that's kind of how we started. So we had our first distribution very early on. I have some pictures here, and this is our first distribution here. That was March 17th. We sent food to the community health representatives in Winslow. We really wanted to work with the tribal government because they have the data on who's highest risk, where are the elders, and would know how to best place resources. And then, there's a little more of the background here. But basically our objective is to flatten the curve. And so part of that is providing food, 2 weeks worth of food for people, for an entire household actually. And then we want to also provide PPE like masks and hand sanitizer For a long time, it was mostly hand-sewn masks. Now we've kind of transitioned to, now that there's more access to surgical masks, we're including those and also hand sanitizer. But for a while, we were, buying hand sanitizer in bulk, and, to the kindness of really incredible volunteers, they were pouring them into 4-ounce bottles, thousands, tens of thousands of these. And we were including these in our kinship care packages that we were handing out to households. And that provided, again, 2 weeks worth of food so people could stay home and just have, the confidence that they were not exposing themselves to anything. And then also the ability to sort of sit through the initial cycle of symptoms and prevent community spread. So if someone got sick, they could just go to the hospital instead of, walking around and spreading the sickness. So here's some of our volunteers very early on. That's part of one of our initial loads. We had volunteer shoppers down in Phoenix, and Dolores drove down there and brought the food back up north to Navajo and Hopi. And again, our motivation was wanting to protect our vulnerable community, having high numbers of elderly, diabetic, asthmatic, cancer-afflicted individuals, because the Navajo Nation's been a national sacrifice for almost a century. The first act of our council was to sign off on an oil and gas lease, and that's kind of been the legacy. And we have, thousands of uranium sites that are still not remediated. So we have a high level of cancer, incidence of cancer here. And so we wanted to make sure our community would be well equipped to combat this issue. And unfortunately, I think I'm probably running a little bit out of time, but I did want to just include our slides here so you can see a little more. And then, of course, the other issue is that a third of the households on Navajo and Hopi don't have running water. Another third don't have electricity in the home. So that makes storing food difficult. It also makes constant hand washing difficult. And then, of course, there's the poverty situation with, more than half of our community unemployed at any given time. So that, adds the food insecurity issue. But here's another photo of some of our volunteers preparing food boxes in Flagstaff to send to our communities on the reservation. Most of our volunteer teams are located on the nation. And, working with the curfew has been difficult for us. We've sought waivers of that, but that's not been allowed by the tribal government, unfortunately. So we work within those restrictions. Yeah, that's just a little bit about us. We've worked on the public education piece. I'll show you guys an example of what we're doing in terms of public education. So here's, culturally relevant. I don't know if you can see this, but this is a one-page, essentially cartoon, mostly visual. We produced it in Navajo and English. It just provides the basic overview of COVID-19, like social distancing, who's highest risk, what you should be doing, like social gatherings of small numbers and, not bringing someone outside of your household, what to do if you come down with COVID-19. Some more of our really incredible volunteers. We've served over 80 of the 110 chapters on Navajo and 9 of the 12 villages on Hopi. Many of those communities have received multiple distributions. So we've just been focused on, that proactive measure. Here's some of our board members and staff of making sure people are able to stay home and do what they can to avoid contracting COVID-19. There's some video links in here as well if you're interested in a little more detail. Here's some information about our group, and that's it. So thank you very much. And again, it's been an honor, and thank you all for your interest in this subject.
Bonjour. So, Babiwash Indigenous Makwendodem, Mashkizibing in Dunjaba. And I'm gonna kind of wrap up this presentation pretty quickly to talk about our community. I live on the south shore of Lake Superior, just outside of our reservation. It's called the Bad River Reservation. And so we have no COVID at the moment. but we're really feeling quite a few effects from sort of collateral effects related to COVID and the lockdown. One of the things that started happening in the first couple of months was overdose rates started skyrocketing, and there were many people who were experiencing overdose, and several of our community members died. Housing evictions have gone way up, and the inability of people to pay rent because of unemployment. Our casino shut down in March, and that was a really good thing because I think it contributed to the fact that we have no cases of COVID within our reservation, but it has meant that many people in our community are employed at the casino. It's the largest employer within the whole county, and when you think about tribal government and civil jurisdiction, one of the issues that we run into with respect to the inability to exercise civil jurisdiction over non-Indians and the fact that there's many non-Indians living on our reservation means that our governments cannot raise revenue in a very effective way through property taxes. And this was recognized by the federal government, and with the National Indian Gaming Act, this is, gaming has been a really great source of revenue for many communities. Our reservation, our casino is very small, but it does provide quite a lot of governmental revenue, and that also translates into jobs. So with our casino closed and no revenue coming in through that casino, we still don't have any kind of taxation authority in terms of property tax levies. The future of our governmental operations and all the jobs that are associated with tribal employment are really at risk at this point. And so this is a real financial crisis in the making. We also have a lot of COVID vulnerable families. So, multi-generational families. We have a lot of community members. A lot of Anishinaabe are in jails and correctional facilities with their children being raised by grandparents. And so these, the schools are opening up, and the expectation of the school district is many of these kids are going to go back to school and ride the bus 45 minutes one way in a pandemic. And so having, these families, we have very high rates of diabetes and heart disease and other conditions that make people vulnerable to COVID, in addition to just the multi-generational nature of these households. One thing that I think has contributed to the overdose rates is this epidemic of loneliness that people are experiencing, and fear and anxiety. And trauma is intergenerational trauma was touched on in the earlier presentation. That was so good. One thing that we have within our communities are very close in time experiences with pandemics when many people passed away in a short period of time because of infectious disease. And I think that is, that's triggered and maybe hasn't been explored very deeply in the literature or anything, but I feel like we're seeing this in our community. So my friends and I have been running a program through the last couple of years to work on outreach to people who use drugs in our community. In the early 2010s, there was a spike in just a number of people using drugs, injecting drugs, and that's really, that's related to the opioid epidemic per se, and the fact that so many of our community members were overprescribed opioids, and then were not able to access those opioids once the government started cracking down on that. And so we have a lot of people who are experiencing substance use issues. So we work with people who use drugs, and we provide all kinds of different services. It's mainly injection services. That's what gets people in the door, like injection materials, sterile materials, naloxone. But then we work on social support, getting people referred to treatment if that's something that they're interested in. Most of our participants are Anishinaabe women, and we're run by Anishinaabe women, but we're supported through funding that we raise. The funding is administered through the tribal government. So what we've been seeing in our community and in our program is a real increase in a need for services that happen right away, and a lot of people in crisis. It seemed like a lot more people were needing injection supplies. We had several of our community members die of overdose. We had a young man who was killed by an assault from some other young men within our community. And I was out there probably doing 2 to 5 contacts per night after my job. So I would go out and run for supplies. We had to be purchasing a lot more supplies because there was such a demand for services. What we've seen later is a much decreased demand in the last couple of months. And what's really hopeful is that it seems like a lot more people are entering into treatment or getting connected with providers who can offer them medication-assisted treatment. So that's a real positive thing. There's a lot less demand for a program at this point. So it's that's great to see. I mean, one of the things I also do in my work is I provide pro bono services to people experiencing eviction. And lately, I've been representing a lot of Anishinaabe grandmas and grandpas. And what's really problematic is the fact that so many of these grandmas and grandpas are getting evicted from their homes, their public housing homes, because of drug activity. And the 1994 crime bill, which informs a lot of HUD policies and actually regulates public housing, has these very punitive restrictions related to people who use drugs in their communities. One drug conviction will bar you permanently from public housing, even drug-related activity that a person is not necessarily involved in directly can lead to these evictions. We've also seen with the child welfare removals, one of the things that has happened, and I was given permission to tell you a story about a woman that I work with. She is raising several of her grandchildren, and her kids are in the system, in and out of jail. And so she's on her own. She's like a single parent raising these children. With COVID, she lost her childcare because nobody's taking in other people's children, so she can't work. And she has been on the list for unemployment since March and hasn't received any income. And so right now she's just a hair's breadth away from being homeless with these grandkids that she's raising, and isn't able to get childcare assistance because she's not working. She'll only be able to get childcare assistance once she starts work. So she's really in a rock and a hard place with trying to do the right thing, trying to raise her grandchildren, and not having access to the resources that she needs. Unemployment is still not coming in for many, many, many people, and it's leaving them in a very precarious position. So, I want to end with this idea that we need to support our most vulnerable families. And there is a GoFundMe campaign for the grandma, and I can actually pull that up and I'll put it in the chat. So what I see is needed for some of the policy changes on the national level are to extend the federal eviction moratorium and to make that unconditional. I was able to win a temporary sort of a dismissal of an eviction that was on a temporary basis because of the CARES Act. And there was a lot of confusion about what the CARES Act said and what the moratorium actually meant. But the moratorium was unconditional. It prevented the filing of any evictions for 120 days after it was passed in, I think it was in March. And there was quite a bit of confusion on the part of HUD and other agencies who wanted to interpret that in a different way, to allow for the evictions of people for things like having an overdose occur in their home. And and so these families who are experiencing substance use issues are absolutely vulnerable, and they need housing in order to stabilize, in order to get the treatment they need. And so that federal eviction moratorium has to be extended, and it has to be unconditional for the time that we're experiencing this COVID pandemic. On a long-term effort, I would really like to see changes to federal housing laws and regulations to protect these families, and to revisit how these very punitive mass incarceration housing laws are impacting families, relatives, people who are vulnerable. Certainly, we need increased funding for IHS, tribal governments, and remove the barriers to accessing buprenorphine, that's Suboxone, which is a medication to address opioid disorders and other substance use issues. I would really encourage everyone to take up some housing cases. They're fun. They're an easy way to do some pro bono work. It's oftentimes not a large commitment, and you can make a huge difference in someone's life. So with that, I'm going to conclude Shimigwich.
Great, and I think that we have about 15 minutes left here, so we're going to go ahead and answer some questions. April, do you want to moderate some of those questions that we've received through the Q&A so far?
Yes, thank you, Charles. So this question can go to the panel generally. So one question is, COVID has had a great impact on employees and employers, and there's been a lot of discussion about opening up. The question is, how much emphasis should there be, or has there been, on employers taking responsibility for the safety of their employees?
This is Isla. I can kind of speak to this generally. We have seen through efforts from state and local governments as they've been implementing different mask requirements, shutting down certain high-risk areas like fitness centers, bars, restaurants, some way to hold employers accountable through some sort of fine or potentially other penalty. What I have noticed, and I can't say that I've looked at some of the tribal orders as much in terms of what their fines and other penalty structures have been, unfortunately, but a lot of jurisdictions are kind of reluctant on actually fining and have been relying on warnings. or maybe not have some sort of enforcement measure, which is really poses a lot of challenges. There's no one to call in terms of when there's violations. You know, on the flip side of this, which I think speaks more to the question, is about, you know, what kind of tort liability. So if some sort of action from an employer is negligent or causing an intentional harm to their employees, you know, what should be done in terms of holding the employer accountable? Now, I can't say that I've got most any expertise on this kind of area of tort law and negligence, but I am really curious to see how this unfolds over the years when employers are doing intentionally risky activities, and what kinds of lawsuits that have already started and will continue to start on this issue, and then what kind of damages. So, you know, is it going to be a financial relief in terms of what's going to be given to these employees? And I think a lot of that is really up in the air in terms we don't know exactly how the courts are going to be applying tort law in this area.
Okay, great. So another question has to do with food insecurity. So regarding food insecurity and the difficulty in accessing grocery stores with quality produce, some articles have talked about people on the Navajo reservation returning to traditional farming methods to grow their own food. Does anybody have a sense of how common this is, and has it been helpful in addressing food insecurity, or is it still very uncommon?
This is Heather, and Ethel can probably add to this as well, but it's definitely a growing grassroots effort, right? Dene Bakea is an organization that actually has a program on kind of tribal food sovereignty, reintroducing the traditional food sources, helping families start their own gardens. So I'd say it's something that is definitely starting, but it's still in kind of the early stages. Yeah, I don't know if Ethel might have something to add to that as well, but
yeah, I think there's been just in general a lot more activity with respect to that. I just monitoring social media. It seems like there's been a lot more media attention on that issue, and then others just wanting to make sure that you know, they have a garden and can protect against food shortages, either just in the aggregate in the larger community, or, you know, just in their local community as well. And there's been a lot of desire, I think, in the Navajo community to do more of that. And so this has kind of kick-started a bunch of individuals. It's really, I think it's more of a movement, you know, there's not like any particular player that's advancing that at this moment. There are a lot of actors. This is an issue that a number of people have worked on the nation for a period of time, you know, trying to promote healthy eating, and then also a concept that's called food sovereignty, so that, you know, we're producing our own food within our borders, and so we're not vulnerable to disruptions in the supply chain like what we're seeing with COVID-19. And this is absolutely something that our group wants to work on long term. We didn't, unfortunately, have enough time to really do that going into the spring, into the planting season this spring. But I know, like, we're trying to buy food from local farmers and ranchers. You know, some of our meat is supplied by Litson ranches. We've purchased food from Coffee Pot Farms. We bought lettuce from them. We have an ongoing relationship with the farmer that's providing squash and corn. And, you know, every week we get, you know, multiple crops from those folks. And we just had another farmer reach out to us. And so we're starting to buy lettuce from them. So we're trying to help in that way. Next year, hopefully, we'll be able to help in a larger way and get all of our fruits or our vegetables and meat from local farmers and ranchers. That's kind of the dream. And then we also want to start funding infrastructure. Like there are a number of really great irrigation channels on the nation, but they're in disrepair. So we're hoping we can help repair some of those and really help stimulate the farming activity. And then of course, in 2016, there was the Gold King, or 2015, the Gold King mine spill, and that took out a bunch of farmers in what I would call our Navajo breadbasket in the Shiprock area. And so a lot of those fields, the farmers have not recovered. That's all still in litigation. And so they lost that literal seed money, and so they don't have a way of resuming activities. So that's really what we want to focus on next year. And we are planning for this to be, we plan that it's going to take a year for there to be a vaccine. So we expect to be operating for that period of time. We're really concerned going into the winter because, with what happened with the Spanish flu, there was a similar lull where it seemed like things were going to get better, and then the regular flu and cold season happened, and things became really fraught. So we're trying to, prepare, build stockpiles, and be ready for that. But yeah, so I love that question, and thank you for that.
I think here in Bad River, up in the north, our food sovereignty isn't just related to the food that we grow, but we have off-reservation treaty rights that we reserved in several treaties that extend over millions of acres of land. And so right now, folks are just getting ready to start harvesting wild rice, which is a great food, and it's a great activity. And I'm gonna go out this week, and I can't wait, because it's one of my favorite things to do every year. And a lot of our food production, our wild food production, is quite substantial. But just like in with non-native people, we're seeing reductions in the participation, especially in hunting activities. And so I'm going to be really curious to see whether our deer harvesting season is changed at all in the time of COVID, and whether these trends in producing your own food also translate into an uptick in the wild food production, because we do have the capacity to provide quite a bit of good, healthy nutrition to folks, even if they're experiencing unemployment, and even if they're experiencing some homelessness. We can figure out ways to provide supplementation and shelf-stable food for folks that's really healthy and nutritious. I mean, these foods are the ones that we have been eating for millennia, and they're the reasons that we're so healthy and strong today, and that we've been able to survive even despite some pretty horrific trauma.
Okay, great. So there's another question relating to water security with respect to running water. So the person asks, I've heard of some programs installing running water systems. How is that being received? And is there still a push to get people running water?
I'll answer that. This is Ethel. I think people are very thankful. The problem is that that's very cost intensive and slow. So I think there's just not enough of that happening. But I do know that there are some efforts. I can't remember. There's one group, I think, that's trying to install wells at people's homes. But yeah, again, it's just it's going to take a while before that reaches a third of a population of 170,000 people. So yeah, that is needed. That's very needed. And I'm hoping that the government will step up in that capacity.
All right. So another question is, what kind of safety measures are being put in place in terms of students returning to school in Indian country? Are there options for virtual learning? Are children and staff being staggered? Is this information that anyone on the panel has?
This is Ethel again. I mean, I think it varies depending on the school system. Like on Navajo, we have public schools, we have BIA boarding schools, or well, BIE, Bureau of Indian Education, and then we have locally controlled grant schools that are funded by the BIE but have their own board of directors that make decisions pertaining to that particular school. So I don't think that there is one coordinated approach that's happening from what I've seen. My nieces are in the local public school, off-reservation public school system. And, you know, one of the youngest one, her public school is actually on the reservation. And so they're getting, you know, they got hot spots to my mom, and my nieces both have iPads or some kind of tablet. And they're basically doing classes in a Zoom style model. I know the high school student had a choice of whether she was going to, you know, go back to school in person part-time. I think it's like every other week, and then be virtual part-time or be entirely virtual. But, you know, my mom is over 65, and so to be most protected, they chose to do all homeschooling, even though, you know, it's going to be interesting how this happens because 40% of the Navajo Nation is a cell dead zone. So I don't know how effective these hotspots are going to be.
Okay, and this question might be for either Heather or Ayla, who talked about historical trauma. So a person from Michigan says, I'm from Michigan and wondering about any feedback about concerns about tribal-state relationships, mainly related to the COVID situation and health response.
Well, I think Ayla touched a little bit in her presentation about the challenges, right? Initially, I think there wasn't a lot of good coordination going on. You're going to have your state, but also your county, and then the tribal government. And so CDC was a little slow to get involved and to help coordinate on like things like data collection. And then each state is going to vary on what established relationships they have in place with the tribes, you know, that might have one within their state borders. And that, again, can have go into a lot of the history of, you know, very complicated of state relationships that can, you know, some states will be better than other states with that. Ayla, anything you want to add to that?
Yeah, I mean, that's a great question, and I can't necessarily speak specifically to Michigan and relationships with tribes that are located within the border of what's now Michigan. But generally, when we're thinking about emergency preparedness activities, you know, there's so many measures that could be done to facilitate these relationships, you know, ideally before, but certainly during, and then improving systems in place after. When you're assessing an emergency. So for example, when you think about the incident command structures and the emergency operation plans, whether it's at the local level, the state level, the tribal level, you know, a plan should include how and who you are going to be coordinating with in terms of your partner incident command structure with your neighboring jurisdiction. So who is going to be the point person at the tribal level? Who's going to be the point person in the incident command structure at the state level? And that's why it can be so variable. Unfortunately, not every jurisdiction, whether it's a tribe, state, or local government, is going to have a robust emergency operations plan, even when they're required by law. And sometimes they're not updated, sometimes they're not practiced. And so even if they have a system, it could be grossly outdated. So including intergovernmental coordination in planning, practicing those plans, and then implementing during the emergency is super important. Also having, depending on what, you know, a tribe is comfortable with under the law and with liability and government immunity, having mutual aid agreements, data sharing agreements in place. Now, ideally, this would have happened beforehand so that you had enough time to be able to craft them so that they're not going to be undermining tribal sovereignty. But there's no reason why folks can't engage with those now, and that can be particularly important. And also leaning on and leveraging the strengths and resources from each jurisdiction. So, a tribe in an area might have more resources in terms of staff or certain type of equipment, and where could that be of use to their partnering communities, and where can the partners then support the tribe? And that could be all implemented, and this is why emergency preparedness is so important.
Excellent. I will turn it over to Charles now.
Thanks, April, and thank you all for your participation in today's webinar, and thank you to the panelists for presenting today. I learned a lot, and I know our attendees did too. Just a few really quick notes to all of our attendees. If you submitted a question that didn't get answered, don't worry, I'll be sending the list of every question that was sent to us to all of our panelists. And all attendees will be receiving an email from the network with the video playback of this webinar, as well as a link to our brief webinar survey. The survey takes just 1 minute to fill out, and it provides us with some really great insights, especially in regards to what topics you might be interested in for future webinars. You'll also be receiving an email from ASLME with information on how to apply for CLE credits for this event. Finally, join us this September for a virtual summit on COVID-19 response and recovery. Registration is free, and you can sign up at networkforphl.org/summit. That concludes today's webinar. Thank you all for attending, and have a great rest of your day.